So here we are going to focus about the child abuse. So abuse is the non-accidental physical injury or the non-accidental act of omission of care by parents or a person responsible for a child. Or abuse comprises neglect and physical, sexual, or emotional maltreatment. So basically, here we can see the type of abuse. Maybe physical, means intentional use of physical force, like hitting or shaking, bumping. Also, another abuse is called emotional, means behavior that is harm another person's self-worth or emotional well-being, like rejection, or sometimes sexual, like forcing a person to engage in sexual act, like penetration or founding, or sometimes neglecting is neglects also the child abuse. Neglect means failure of a caretaker to provide a basic need, that is housing, food, education, or access to medical care. So neglect can be in the form of physical or emotional neglect and involve the deprivation of basic need, supervision, medical care, or education, and failure to meet a child needs for attention and affection. The child abuse continued. The sexual abuse can involve like molestation or exhibitism or pornography, prostitution, or finding associated with sexual abuse may not be easily apparent in a child. It's easy to explain if forcing a person to engage in sexual act. Another abuse is second baby syndrome. You can see the picture. Is caused by violent shaping of an infant and result in intracranial, usually subdural hemorrhage or intracranial trauma, and that can lead to the edema and death. So next go. So child neglects and abuse. Neglects, example here, inadequate weight gain, poor hygiene, or consistent hunger, inconsistent school attendance, constant fatigue, and report of lack of child supervisions. In this table, showing possible sign of neglect, physical neglect, or here, adequate food or clothing, appropriate medical care, supervision, proper weather protections, behavioral, maybe stealing food, constant fatigue, inappropriate checking of attention. So neglects, I said, frequently absence from the school. It is sign of negligence. or beg of, or stealing the food or money, unclear cloth, dirty cloth, body odor, poor dental health, or dis- disease inappropriately for or dressed inappropriately for the weather. It is the example. And next here, physical abuse, unexplained bruise, burn, fracture. So if baby go to the school and during the play football or soccer, broken the legs, it is normal. But if anybody say broken the ribs or any kind of bruising or spot in the buttock, it means abuse, right? Like blend spot on the skull, apprehensive child, extreme aggressiveness or withdrawal, fear of parents, lack of crying, or fracture without history. So the sign of abuse, particularly physical abuse, it is incompatibility between the story and injury, or multiple injury in various stages of healing. Multiple injury in various stages of healing is a sign of physical abuse, or bruising on cheek, neck, genital organ, buttock, or back. So it is means abuse. Accidental bruises are typically found in extremities, two legs or two hands. Bruises in shape of the causative object like belt, or burn in the clear shape of a hot object like cigarette, or force immersion burn pattern. Also sometimes as spiral fracture indicate of a twist injuries. The sign of here, like the second baby syndrome. So sign of second baby syndrome: poor feeding, in irritabilities, lethargy, vomiting, seizure, period of apnea, or retinal hemorrhage is a sign of physical abuse. So let me read it. External sign of trauma are usually absence. Ophthalmoscopic examination reveal retinal hemorrhage, and also full bulging frontally or head circumstance greater than expected. It is a sign of second baby syndrome. Emotional abuse here: speech disorder, habit disorders such as the sucking, biting, rocking, or psychoneurotic reaction, or suicidal attempt. So emotional abuse, extreme behavior, that is overly compliant or demanding, or extreme passively or aggression, or delay physical or emotional development. Next is sexual abuse: difficulty walking or sitting, or bloody underclothing, pain, swelling or itchy of genital organ, bruises, bleeding, laceration in genital organ or anal area, or unwillingness to change the cloth, or unwillingness to participate in gym activities. Also poor peer relations. So sexual abuse is easily to distinguish. Children difficult to walking or sitting, they exhibit the strange or advanced sexual behavior or understanding for their age. And sexually transmitted disease or sexually transmitted infection and or frequent urinary tract infection more common. Also, new onset of nocturnal emesis means uh, frequency of urine at the night time or bed wetting is a sign of sexual abuse in children. So if we get any patient like this, what should be our nursing care? So before to go nursing intervention or nursing care, I want to recap one more time who are under risk of child abuse. The risk factor, sometimes poor education, low socio-economical status, or substance abuse, family history of violence, also low self-esteem. The victim risk factor, usually intimate parental violence, hmm, or child abuse, unwanted, unplanned pregnancy, or children with a special need or disability. They chance to more victimized risk factor. So increase the risk of child abuse when domestic abuse is present. Also, elderly abuse, sometimes chronic health challenge like Alzheimer, also frequently chance to attack the abuse. So, what are the intervention? Support the child during thoroughly physical assessment. Also, assess the injuries. If the second baby syndrome is suspected, monitor the infant for a decreased the level of consciousness, which can indicate increased intracranial pressure. Report a case of suspected abuse. Nurses are legally required to report all cases of suspected child abuse to the appropriate local or state agencies. So in this picture, we get a summary of child abuse sign like head injury, usually skull and facial fracture, bruise, and the sharp objects. Child may protect abuser for fear of punishment, burn, human bite, or rough burns from being tied up, or little eye contact with adult, inappropriate response to pain, fracture in the different stages of healing, internal injuries, also burn on buttock, genital, sore or feet. So it is the sign of child abuse. What else? What are the nursing care? Place the child in an environment that is safe, preventing further injury, or document informations related to the suspected abuse in an objective manner. Also assess the parent's strength and weakness, normal coping mechanism, and presence or absence of support system. Assist the family in identifying stressor, support the system, and resources. What else? We refer the family in appropriate support group. The nurse are legally required to report all cases of suspected child abuse or elder abuse to the appropriate legal or state agency or state law, and also procedures may vary and are always allowed. And lastly, I want to recap one more time. If any children had a chance of abuse as a health provider, we go for assess the patient as soon as possible after incidents. We provide immediate care for physical injuries, also clearly identify and keep document like photography, right? Also interview the parents or patient, especially from caregiver. Also report suspected abuse of a child, elder, or vulnerable adult. And that is required as a mandatory report. The nurse does not have the burden or of providing the proof, just the fact and circumstance that lead you to suspect the abuse and neglect. We should collect and prepare the evidence for legal purpose, or we work with the patients to develop a safety plan, that is, plan for escape if abuse reoccur, or we provide reference and information, so, or safe houses or shelter. Before to finish, here is the one um, terminology. It is called latch, uh, latchkey child. Latchkey child means the child who do not have adult supervision before or after the school hour, and they are left to the care for themselves during this time. Also occur when the children are members of a single parents family, or when both parents work and need to leave the home before children are brought to school. And this situation induces a stress provoking environment for children and places the children at the risk for an unsafe situations, injuries, and also any kind of delinquent behavior. So what are the intervention? We identify the latchkey child, encourage the parents to teach the child about the self-care and self-help skill, assist the parent to identify possible in alternatives to leave the child alone. Also inform the parents about available community resources such as after the school program for the children.